Experiential work is really core in acceptance and commitment therapy. So there's the language that we're using in the conversation that is therapy, but we're also looking for opportunities to invite people to do work that gets more at experiential learning and less about lots of words. But that experiential work is very simple. It might simply be, hey, as we get started today, can we take a moment to both just close our eyes and maybe just breathe in, breathe out. Noticing as we inhale the sensations of our breath as our chest and belly rise. As you exhale, the sensations as they fall. And maybe notice how your body feels in the chair. And then when you're ready, let's pick something to make important today and spend our session on that, or start our session on that. Just a simple breathing exercise. It might just be sensory. I just want you to notice, wow, you came in really flustered. Can you just notice your weight in the chair? Notice the sound of my voice. Notice your breath. We're inviting people to get present. We're inviting people to notice. We're inviting people to get their attention on what they want to make important, not necessarily what is stirring in their minds. In addition, other experientials might include inviting people to take a moment to stop and notice, what are the thoughts and feelings going through your head right now? Can you just tell me what thoughts you can notice in your thinking? Right? Notice I'm not saying, what are you thinking about? What are you feeling? What thoughts can you notice? Can you label those thoughts? Can you label those feelings? We want in diffusion work to get people out of that fused place. We want people to have a little distance and to be able to look at their experience and say, oh, that's the experience I'm having, as opposed to that narrowed view that distress tends to bring of this is how it is, this is who I am, this is how it will always be, right? Thoughts come and go, feelings come and go, sensations come and they go. Can we notice them? Another important thing to consider, and I think this is really important for depression, is if we can look at self-stories and how they're controlling behaviors, we can invite people to look at their own experience from different perspectives. If my self-story as Hannan was, I'm broken, there's no point, I'm not going to get well, there's something wrong with me, that for her feels really permanent, really true, really forever, right? And what I want is for her to walk down a road, almost let's time travel out into the future. If that story keeps deciding how you live, what does your life look like in a year? Let's really talk about that. Let's talk to future you about sleep, don't work, don't socialize. Okay, now you've been doing it for a year, every day for a year. Can we talk to future you about how she feels about that? You can imagine it's a hard conversation. Well, she wouldn't be very happy with me. No, she probably wouldn't be very happy. What if we imagined, even feeling broken and useless, if future you could look back on a year spent getting more active, taking care of yourself, getting a job? What would that future you tell us? What would she have to say about how you spent your year? So you can invite people to use future self, other versions of self, to interact, open up that distressed narrative to, oh yeah, I'm not sure I want to live like this for the rest of my life. And then they snap back to, but I have no choice. So there's no one trick here, an ongoing conversation.